To monkeypox, the number of confirmed cases in the U.S. up to almost 5,200 now, according to the CDC. Leaders in San Francisco and New York State declaring states of emergency over the outbreak. And new tonight, New York City Mayor Eric Adams now declaring it a public health emergency. Monkeypox patients are reported in nearly every state now. The U.S. also has the most reported cases among countries that have not historically reported monkeypox. For more on this outbreak, we are joined now by Dr. Syra Madad, an epidemiologist at Harvard's Belfer Center. Dr. Madad, thank you so much for being here.
Thank you for having me on.
We know San Francisco and New York have declared a public health emergency. The federal government has not declared an emergency. Why not? And do you think they're dragging their feet?
Yeah, I certainly think it is past time to declare this a public health emergency here in the United States. As you've just mentioned, New York and New York City in particular has also declared state of emergency. Let me just give you a bit of a context here. So, we have 22,000 cases around the world, over 5,000 cases here in the United States. And in New York City, which is the epicenter of the United States of the highest number of monkeypox cases, we have over 1,300. We know that's just the tip of the iceberg. Here in the U.S., we are seeing doubling of cases every single week. So just imagine 5 weeks ago, we just had about 200 cases. And, flash forward, 5 weeks now, we have over 5,000 cases. So we know that cases are increasing, and we need to do everything in our power, both at the federal, state, and local level, to contain this virus before it becomes an established, virus in our communities. And that is really just very unfortunate if that's going to be the case. And that seems as if where we're heading.
You're doubling every week. I certainly appreciate that context. You are an epidemiologist, so we want to benefit from your understanding of this. How is this outbreak looking at this point? Is it too late to get out in front of it? And will we just continue to see the cases rise exponentially?
Well, I think it's never too late to try to contain an epidemic. There's always tools and resources at our disposal that we can use to try to put a lid on the epidemic. The unfortunate part is this is an emergency response. And by its very nature, emergency means you have to work fast. And as you've mentioned, the United States hasn't declared a state of emergency yet, even though cities and states have, because they're seeing large numbers of cases. And so we need to do everything in our power right now to try to box in the virus. And when I say box in the virus, it's really these four main cornerstones. It's making sure that individuals are testing, and so clinicians are aware of what's happening and they have a high degree of suspicion. And then individuals in the community also understand it's important to get tested if you think you've been exposed, if you have a new rash, or if you have multiple sexual partners. Second is ensuring that people have access to resources like vaccines and therapeutics. Third, isolating people that are infected. So what are we doing about providing services that people have to isolate for 3 to 4 weeks if they have monkeypox? That's a long time. And then really fourth is contact tracing. We're really struggling with contact tracing. And what this means is that if someone's infected, you're going to contact those that may have been exposed and ensure they have, access to, for example, vaccines. We're struggling with contact tracing, because right now the epidemic is largely in the men who have sex with men community, and many are having multiple sexual partners. Many of them are also anonymous. So we don't have that information, that data that's missing. And so we really need to box in this virus here in the United States to try to contain this.
And doctor, if we can focus on the vaccine aspect of it, we are hearing that the San Francisco Health Department, for example, has requested 35,000 doses of vaccine. They've only received 12,000 doses as of Thursday. Does the U.S. have enough monkeypox vaccine doses for widespread use?
No, we do not have enough vaccine doses. In fact, if we just calculate how many individuals in the United States that are at risk in the population that are, HIV positive and men who have sex with men, that's about 1.6 million individuals. And right now we don't have enough doses. So it's a 2-dose vaccine. The Jynneos is a 2-dose vaccine. We do not have enough vaccines to vaccinate at least at 1.6 million at-risk individuals. Just by the end of this year, we'll have close to 2 million, but nowhere near that 3.2 million that we need for those 2 doses. So we don't have enough vaccines. There's a big demand, but not enough supply. And so that's where there's a big challenge here.
We are hearing about the first deaths from monkeypox in Europe and Brazil, none in this country yet. Bottom line this for us, how dangerous is it for people who get it? Should people be concerned? And what treatment is available for people?
Yeah, excellent question. So first, when we talk about monkeypox, it is generally a self-limited disease, meaning individuals can recover at home. Very small number of individuals require hospitalization. So in the UK, we're seeing about 10% of cases. That data is not available here in the United States, but usually a small number of people. But it's not a benign virus. People are in excruciating pain. They have a hard time carrying out daily activities, like just going to the bathroom because of where these lesions are located. And then there's also access to treatment. But access and availability are two different things. There may be available treatments, but access is still a bit of an issue, particularly here in New York as well as around the United States. And so making sure that you know where to go to get treatment is just really, really important. And so how to keep yourself safe, that's a big question that many of us are getting here in the infectious disease community. So what's important is that what we know about monkeypox is that it's largely driven by skin-to-skin contact, mainly through sexual activity. So if you're going out in the community and if you're going to places where there's a lot of skin-to-skin contact, clubs, bars, try to limit that interaction, wear full sleeve clothes. If you're having a sex with multiple partners, ask a question. Do you think you have monkeypox? Do you have, rash or new skin lesions? Just be open about it. Have those discussions. If you think you're exposed, contact your healthcare provider. If you're in New York City, you can call 311 and get connected to somebody to talk about whether you're eligible for vaccine. So there's a lot of resources that are at your disposal, but just making sure that you're aware of what to do and how to protect yourself.
Dr. Madad, this has been illuminating. Thank you so much for your time this evening. I really appreciate it.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.